For more on the response to the shooting, I want to bring in Dr. Jason Smith. He's the chief medical officer at University of Louisville Health, which is treating the victims of yesterday's shooting. Doctor, thank you for joining us. Can you give us any kind of update on how the victims are doing?
Yeah, so we still have one in a critical condition from yesterday. One has been upgraded to stable, and we still have the remaining people that we admitted yesterday in the hospital, except for Miss Eckert, who passed away last evening.
Listen, your staff, they are trained professionals, and they do train for situations like this. But is there anything in the training that matches the reality of what they have to deal with when patients start rolling in?
Well, no. I mean, we do our best to train for casualty events like this as well as others. But until you see this and until you're dealing with the people associated with this, I don't think the toll really hits you until you're in the middle of this situation.
And with that in mind, I've covered several of these and talked to physicians afterwards. How is your staff doing mentally after having to treat this many patients at a traumatic event like this? And is there anything that's going to be done for them afterwards?
Yeah, and I think, the pandemic really brought this into response when we were dealing with all of that, particularly early on. And we've established a lot more as far as physician, nurse wellness, taking care of our staff after incidents like this. And so we have opportunities for them to talk to people, to unburden themselves with what they've seen. And because this is trying and it's taxing, it's difficult to describe how, the people that are responding feel when it's your neighbors. It's the people that it's people that you've seen. It's happening at a place 3 blocks from where you work. And it's just difficult to get through this.
Dr. Smith, I know there's a lot going on there at the hospital. Thank you for taking some time and shedding a little light on what your team is going through. Thank you.
Thank you for having us this morning.